When I was a second year medical student in Michigan, my wife was unfortunately diagnosed with a Hodgkin's lymphoma. And I feel like I should always lead by saying she's doing great. At that time, I had a little bit of medical training. And when we received that diagnosis, it was obviously very shocking and concerning. And we felt ourselves in a pretty vulnerable position. And so we did what I imagine most patients do, right? We went on to Google and we tried to search out information like what are the treatments and what is the survival like? And that was my first real experience identifying how rampant misinformation really was online. Fortunately, I had just enough medical know-how to be able to kind of decipher what was accurate and what was inaccurate, but it was challenging. As I went through my clinical training, I unfortunately encountered a lot of patients who, whether it be from word of mouth, from well-meaning family or friends, or from social media or online, were encountering misinformation and making decisions, unfortunately, led to their early deaths. So that kind of led me down this path of research where we research what happens to patients when they choose to use treatments that don't have a lot of support for their use. Online, I encountered a lot of misinformation about cancer treatments. We analyzed the most popular social media articles found on Facebook, Twitter, Reddit, and Pinterest, kind of the four more common social media sites. And we analyzed cancer treatment articles using experts like Drs. Dorff and Spratt in other disease sites as well. And they reviewed these articles for basically accuracy on one scale, and on another scale, their potential for harm. What we found was that 1/3 of all cancer treatment-related articles found on social media contain the potential, or I guess they contain misinformation. And of those, so of the 1/3 that contain misinformation, the vast majority, almost 80% of those contain, or 70 to 80% of those contain the potential for harm. What can patients do? Whatever you're reading could be true, just to read it with a little bit of a critical eye, especially if it's information that is encouraging you to delay effective screening, to delay diagnostic procedures or delay treatments, or that's trying to get you to spend a lot of money out of pocket. Things like that should be red flags for patients. But importantly, you should rely on the advice of healthcare professionals. Hopefully it's a board certified oncologist. I'm a huge proponent of second opinions. I feel like if you'd like to have a second opinion about the treatment recommendation that's being made because you feel uncomfortable and you've heard something that's contrary to that online,